Hey guys, it's Dr. Justin Marcagiani here. How are you all doing today? We got a live coronavirus update here for you. I just did a live video a few minutes ago. I'm not sure if it came through, so we're going to do round two, take two. Let's see how we do. All right, so everyone gets overwhelmed by a lot of the news and everything, so I like to keep it short and sweet. Just go over the numbers. I'll give you my take on it. My take is based on the numbers, based on some of the experts that I see and read, and I'm trying to keep a lot of the emotion out of it. So good news for the economy. It seems like Easter is going to be when the economy reopens back up. Just saw that live update a few minutes ago. Again, I predicted about 2 weeks, so I was a couple days too long, and people thought I was crazy for saying 2 weeks. So hey, I'm glad that we're on track with that. And again, I think, is the cure more painful than is the cure, meaning the whole quarantining, more painful than the damage done to the economy? That's really the thing, and we have to kind of weigh that. And I think number one, I think common sense wise, we can kind of really keep that bell curve down, which is going to decrease a lot of the need and the use on the hospital. And I'll kind of visualize that for you guys so you can see what I mean. I talked about this here before, flattening the curve, and the issue here is if our cases get too high, as you can see over here, this stresses out our hospital capacity, and if we decrease that curve like this and flatten it out, then you can see what happens is the healthcare system does not get overwhelmed, and that's really where I want to be here. I want to make sure that system is not overwhelmed. That's very, very important. Okay, let's keep on rolling. So a couple things. Make this big so you guys can see a little bit better so you aren't squinting on your iPhones there. This article came up on Yahoo last night. Nobel Prize laureate predicts a quicker coronavirus recovery. We're going to be fine. This guy is important. Why? Because one, he's a smart guy, but two, he predicted what was going to happen in China back in January when the WHO was going nuts, saying there was a 3.4%-ish death rate, which would have been really bad. So the nice thing is, if you go down here in the article, he actually had predicted the amount of deaths, which was really nice. And people were saying a lot of deaths, like millions in the millions, and he was 100% correct, which is great. So right here, in COVID-19, he ended up around 80,000 and about 3,250 deaths, and he was able to predict that, which is pretty awesome. And so he's predicting that the growth rate is slowing down, which is what I've been predicting. When you look at the data, we can see that. Also, let's take a look at this gentleman here. Oh, so here's the spread rate. This is called the R naught number or the R0 number. This is the spread rate. Now, I think this is a little bit debatable. Part of the reason why I think it's the estimate of how many other people one sick person is likely to infect. I don't think this is correct. And the reason why is we're just not seeing the amount of people, the incidence of people getting sick in larger countries like, for instance, China, right? How many people got sick in China? Let's go look at the data, right? In China, we saw 81,000 cases, right? Now, let's say they're off by a factor of 10. Let's give it 1 million cases. We're still not close to the flu, right? The flu's killing or infecting 35 million people a year in our country, killing 36,000 on average. So we're not even close to the flu. So this R naught number or the R0 number, I really think it's debatable, primarily because of the fact we don't know the full math on it. We don't know the full case incidence. We're running hysteria math. Well, what does that mean? Let's go look at that. Hysteria math is this. We have this many cases. Let's use this afternoon's data, 51,163. We have 658 deaths March 24th, midday. That mortality rate's 1.29%. That's 658 divided by 51,163. Okay, 1.29%. Remember, the WHO recommended or estimated 3.4%. Guess what? We're way beneath that. That's good. Now, that's the hysteria math, okay? Now, here's the real math. 51,000 cases, 658 deaths. Now, here's where it gets interesting. The mortality rate's 1.29%, nothing different from the hysteria math. Now we're trying to predict how many people outside of the known cases got the infection. Because we know 86% minimum, according to research, right? One study right here. Let me pull up this one study for y'all. There's one study down here shows 86% are undocumented or asymptomatic. Right here. Nearly half or even more. Oh, that's the actual testing data. Here it is. We estimate 86% of all infections were undocumented, and this is regarding coronavirus testing. So what does that mean? That means that for every one person that gets sick, there's going to be at least 7.14 people that actually get the infection but have no symptoms. And this one person here, this one gentleman up here, he actually was the head of Health and Human Services in Ontario, Canada, Dr. Richard Chavas. He said there's a factor of probably 20x, and he gave an example of a 0.5% mortality rate, and he thought it was probably around 20x, and he did it right at the bottom of the article. He said it right here. I'll pull it up for y'all. Where'd it go? So right here, he said, there have been 100,000 cases reported to date, but if we extrapolate the number of deaths and presume a case fatality rate of 0.5%, the real number is 2 million. He's thinking close to a 20x number, right? So I ran the number on a 10x, just to be more conservative. And it's just easy to move the decimal place one spot to the left, right? 0.129 is the number, rounded up, 0.13, okay? And that's 26.15 times lower than the WHO estimate, and that's using real math, not the hysteria math. What's the difference? We factor in the asymptomatic population, and there's population that maybe just have like some minor aches or pains or, just some, runny nose for a day and it's gone. There's even that too. And then we look at the hysteria math for the world. What do we see? 414,000. Again, this was this afternoon, March 24th, 18,000 deaths. Nothing to be, that's a lot of people dying, but in relativeness next to other diseases, it's not that big of a deal, and we don't shut the economy down for those diseases. 4.47 on the fatality side, mortality side. Why higher? Well, Italy and Spain, and there's some countries like Iran that don't quite have the same level of healthcare. Italy got hit a lot harder, partly because they didn't have a travel ban. A lot of multi-generational households there, so parents, kids, grandparents, all under one roof. A lot of smoking, and Italy has the highest average age in Europe. And about, I think it was 7 million people over the age of 80, and 99% who passed had at least one or more comorbidity. That's a disease like hypertension or blood pressure or heart disease or cancer. And average age was 80, right? So this isn't, a big killer in regards to like knocking out a lot of young, healthy people. You see reports of happening today, but, let's face it, the flu kills 150 pediatric patients in this country a year as well. That's not new. So we run the numbers, 414, 18,000 deaths. You do 18,000 divided by 414, that gets you to the 4.47. And then you use the factor of 7.55. So what would 86% of the population look like if they were asymptomatic? 0.653. And what if 10x was asymptomatic? Well, 0.45. So a lot lower than what the WHO says. 7.55 lower than WHO. 5.4 if we go with the 86%. Why 86%? Because I actually have scientific data on that one. And if you look at the other one, Shaba says about 20x. Other CDC people say about 10x. So I'm kind of going with an in-between amount there. So I hope that makes sense why my recommendations are what they are. Okay, excellent. All right, very good. Now, couple of things that came to light. Number one, this guy here, Dr. Vladimir Zelenko, is having some really good results using the Z-Pak, zithromycin, and the hydrochloroquinolone or chloroquinolone, which is basically Plaquenil, okay? And he's using that in conjunction with zinc sulfate. He's using mega doses of zinc sulfate. Here's the article here, and if you click on it, you actually get his protocol. So here's his article, Dr. Vladimir Zelenko. It's a Google document, which is cool. I was able to download it. So he's talking about any patient with shortness of breath, regardless of age, is treated. Any patient in the high-risk category, even with mild symptoms, is treated. Here's the protocol. Hydrochloroquinolone, 200 milligrams, 2 times a day for 5 days. Zithromycin, which is basically a Z-Pak, 500 milligrams once a day for 5 days. Zinc sulfate, 220 milligrams for 5 days. That's a really high dose of zinc sulfate, by the way. I'll tell you, typical dose is like 30 to 50 milligrams. Be very careful. This could create a copper imbalance because that's so high. So just be very, very mindful of that. So hey, at least we're having some pretty good mainstream protocols like this. Now, would I use a protocol like that? Probably not. I mean, I'm going to be in the asymptomatic category. I can guarantee it. And I'm working on upregulating my immune system with vitamin C and vitamin A and vitamin D. And I'm also using medicinal mushrooms like reishi. I'm doing things like monolaurin, things like astragalus and N-acetylcysteine, and doing good, excellent diet, trying to stay more ketogenic. So I'm doing things to keep myself amazingly healthy. But if I did get sick and it was significant, I would look at a protocol like that. And some of you who are listening are more natural minded, more open minded. You'll be listening and adhering to some of those immune boosting things. But if you're more conventionally minded, hey, you at least have some options and you know there's data behind it, even if it's just clinical on the spot data. This guy, I think, has 500 patients that survived. It was 350, now it's 500. So that's pretty awesome, right? It's really good. Okay, cool. So we reviewed the hysteria math. Why is the hysteria math hysteria? Because we don't know the overall incident, right? We don't know the overall cases. Remember that. We talked about the fact that we talked about the protocol here regarding the Z-Pak and the chloroquine, which is great. Now let's go into the data. So first off, I like to just use the worldometer.info, and I just come here and I just have all the countries lined up and I just refresh it. And I just keep a couple of tabs open and I refresh them every couple of hours. I look at the graphs. And so you can see USA, 222, Spain, Germany. You can see all the cases, all the deaths. The US actually doing a really good job. People are, not thinking we're doing that great. But what I recommend when you look at the data like this, it's very overwhelming. Sort by total deaths per 1 million. This is helpful, right? You see the US up here is number 3. Well, go here. Hit that. Watch what happens. Look what happens here. So San Marino, Italy, Spain, Iran, France, Netherlands, Cayman Islands, Switzerland, Belgium, Denmark, UK. The U.S. isn't even on the first page. The U.S. is down so low at 166. They're come up a little bit, but you can see it's actually really, 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 really good. So we'll sort it again here. Hold on. Did I do it right? Total cases per 1 million. And if you look down here, the U.S. is going to be way down here, right, at 166. That's actually really good. So you can see comparatively we're doing awesome. And part of it is, in my opinion, it's the travel ban. The travel ban early on was so huge on January 29th. That stopped a lot of the exposure from people in China here. Now, in general, washing your hands, that social distancing, all that stuff is really smart and is also helping out now. And the economy will be back up soon. So people that are at risk, stay at home if you're at risk. If you're sick, stay at home. If you're young, if you're healthy, I think it only helps going out there and getting your asymptomatic on, getting your immune system to make antibodies. Now you're set. You're probably immune for life. And now you can create a nice little bit of herd immunity for everyone that could get sick. Some natural herd immunity, right? Which is pretty cool. So let's look at our data here for the day. So United States, we're starting to hit the crescendo point. I think we're at the top of the bell curve. You can see here. Daily new cases are starting to slow a little bit. We'll see. We need a couple more data points. Again, I expected the daily new cases to actually continue to rise, partly because of the fact that we had a lot of pent-up demand for all these tests to get done, and we didn't have tests available for a while. So all this demand's pent up. Now the tests become more available, and then what happens is you have all these tests that are all now coming due at the same time. And so that's spiking up the incidence. So the incidence won't be quite as good as linear, so to speak. So if you want to see someone's data that may be cleaner in regards to that is South Korea. South Korea was on top of this from the start because they had MERS about 10 years back. And MERS is another coronavirus. We've been hit with 4 coronaviruses. MERS and SARS, sudden acute respiratory syndrome. MERS is Middle Eastern respiratory syndrome. There's one other coronavirus, and then there is the SARS virus now, COVID-19, which is a 96% bat virus, by the way. Okay? So if we look at the total deaths in South Korea, they're actually coming down. It's hard to see here. They have a couple of pops here, but how we know they're truly trending in this direction is we go up here and we look at the daily new cases, and you can see how that's dropping off nicely. There's about a 1 to 2 week lag time with these cases in the deaths. So we know in general we're heading right down, which is really, really good. All right, so that's just showing. And I'm not seeing any second wave yet, but we'll keep an eye on that too. And this is the general bell curve that we typically want to see, right? This is that we're going to see in general. Here's what China went through. They went through about a 2-week bell curve. You can see from here, going through it all, 2 weeks. So here's the bell curve we talk about here, right? Wanting to keep the hospitals in check by not overwhelming the system here. So you can see this is where lengthening that bell curve and dropping that curve is super helpful. And here is that curve in actual reality in China. This is it. About a 2-month curve. Some countries go through it a little bit faster, some a little bit slower, but about 2 months. So hopefully we keep that curve down. We'll have to keep an eye on it. You can see China, their incidents have also, daily new cases have dropped. Now, people say, hey, we can't trust the Chi-Coms. Who knows, right? I'm just taking their data at face value. Other countries like Germany is also doing pretty good. They had a little spike today, so we'll have to keep an eye on it. So you can see they were doing really good. Nice drop, nice drop. A little pop back up here on yesterday. Let's see where they're at now. So if we go, let's go look at total cases. Germany's at 36 today. Okay, let's go see and compare that. 36, good. So daily cases, and we'll look at their deaths. Okay, so they popped up a little bit, so we'll have to see. We'll have to keep an eye on it. But in general, their cases are dropping a little bit, so we'll see. All right, we'll keep an eye. They may be a week or so away from being on top of the bell curve. And then we talked about Italy already, right? So here's Italy. They're actually coming down. Look at the daily new cases. It's rounding off here, okay? It's rounding off. Let's go look at the death rate here. It's coming down. You guys see in the bell curve right here? You see that? It's coming down. Now, Italy's gone through a lot, right? I mean, this is 6,820 cases is nothing to shake a stick at. That's a lot. But let's compare it. How many people died of flu in the last couple of years in Italy? Well, I got a study on this. So this is investigating the impact of influenza on in all ages in Italy during recent seasons. Let's go back and look at the 2016-17 season. Well, they had 24,981 pass. Okay, 24,981. We're at 6,820. I'm going to guess that when it's all said and done, we'll be around 12,000. Okay, I think we're a little bit past the halfway point with Italy. So we'll see. I mean, we're still beneath flu, and some of these cases may pitter out over the next few months. We'll just have to keep an eye on it. We talked about the United States. I'll go over it again here. So we're starting to flatline with the U.S. So daily new cases, we'll have to keep an eye on this. We're at 1,035. You see the bell curve right there? The bell curve, when you know what to look for in the data, it gives you a good window to predict where we're at in the cycle, which is really cool. I mean, you can even see flu kind of has this cycle too, by the way. Here's this flu cycle. It's a little bit longer, but you can see season starts here, October, boom, up and down. This is about a 4-month cycle, boom, up and down. So there's this general cycle that a virus typically goes through. This virus is taking about a 2-month cycle. Keep that in the back of your head. Okay, so U.S., you can see here, that's United Kingdom. They're actually getting hit pretty hard. Okay, here's U.S., so here's daily new cases, 10,168. Let's see where we're at today. So 11,000. Okay, so we're about 1,000 more. We'll have to just continue. But when you guys learn how to look at the data like I am, and you can do it by going to this website, it'll just kind of demystify a lot of it for you. And daily deaths here, we'll see if we can crescendo down. We're at 140 here, and then today we're at 222. So that's popping up a little bit. I think we're about 1 week away from being on top of this curve. So I'm going to predict here regarding the deaths. I think we're going to be under China for sure. I think we'll be closer to 2,000 when it's all said and done. And again, flu on average kills 36,000 in the U.S. We'll see. I could be wrong. If the data changes, I will always update my response because it's all based on the data. And then you can kind of see where South Korea is at here. You can see their cases have gone through that bell curve, and then you can see their deaths are moving through as well. A couple of little anomalies here, but we know this will eventually flatten out because the cases over here are so low, and they've been so on point with their testing, right? So we know this is about another week or so, and this should flatten out nicely. And remember, these numbers are a lot smaller, okay? 5, 7, 10. So if you look at this graph and you compare it to the U.S. and you freak out, don't worry. We're at different magnitudes of numbers on the y-axis. Keep that in the back of your head. And Spain's actually getting hit pretty hard right now. 2,991 on the death side. And you can see they got a big load of cases here today. And then you can see here their death rate's up pretty high. So they're getting hit bad. And again, part of the reason why we're doing so well, when you look at the number here and you do it by, you sort by total deaths, total cases per 1 million, we're doing so great because of the travel ban. That really decreased a big exposure. Europe's a hotbed for it. And part of the reason why is they didn't close down the flights from China. So I think we reviewed a lot of good things here. We have the death toll here. We have, also one thing to show y'all here is go look at the overall death rate. 18,887. And this is a cool marker to look at. I wish they had it for every country, is this little guy here. This is the growth factor. We want it to be, if it's above 1 but trending downward, this is a good sign. Whereas growth factor constantly above 1 is the sign of exponential growth. So if it's like 1.07, that's a 7% growth. So you can see we had a nice little trend kind of downward here the last 4 or 5 days. A little pop up today, but you see you were at 1 just the other day, which is great. That's no growth. So we're getting really close to, kind of moving through that curve as a country, or as a world, I should say, right? Hope that helps here, guys. All right, any other questions, feel free and chime in. I'll be happy to help you guys out. Want you to be able to look at the data unbiased here and just kind of, create your own estimates based on what's happening. Also understand the difference, right? We have hysteria math and we have real math. Know the difference. One more time so you guys can see it here. Hysteria math, right, doesn't factor in the total amount of cases. Real math factors in the full amount of cases based off of statistical references. All right, any questions, guys? Feel free to chime in. Hi from High Springs, Florida. Hey there, Sandra. Dr. J, thank you for your time. Psyllium husk better to use split doses during the day or before bed? Try to keep it to corona or immune questions, but during the day is fine. Matt Whitewright said, hey, Matt, how you doing? I'm really having a hard time with my mood on this by not going to the gym for over 10 days. 3 weeks left without shelter in place. Home workouts just aren't cutting it, nor is 5-HTP. Well, I would try to go outside and just do a little bit of walking, do some interval stuff outside. I mean, knowing your health and your age, Matt, you're not a risk factor. So I would at least get out there and, do the correct amount of social distancing and get some walking in, or do some sprints or some interval stuff, get some sunlight, do some forest bathing, do some of that. As long as in your area, it's legal to do so with, different shutdowns and curfews. Just make sure you're abiding by the rules. Have asthma, doing ginger, NAC, don't have the glutathione or silver yet. Could I nebulize oregano oil for the excess mucus and cough? I would not do oregano oil. You may be able to do like 1 drop of like tea tree or 1 drop of grapefruit seed extract, maybe 1, but be careful with that. I would add in doing ginger, NAC. Okay, so with the extra mucus, I would be doing the sinus rinsing. Do the sinus rinsing to help with that. You could also add a little bit of guanefacin, which is in Mucoplex. But if in general, NAC, and do the sinus rinsing with the xylitol. So the Xlear, Neti Xlear packets are great. Flush it a couple times a day. I follow healthy keto since 7 months, but I suffer with low white blood cell count is 2.6. What's the cause of this issue? So it just depends. I mean, if it's been that long for a while, I would definitely look at a chronic infection, maybe a gut infection, maybe another type of, co-infection like a Lyme thing. Could be a mold thing. I don't know. I need to know more about you and your health and what's going on. But some level of a toxin exposure or an infection exposure is probably it, especially if your diet and lifestyle is good. What are your recommendations on zinc? Does it have to be taken with copper? I mean, well, in the study here that I put up by this doctor up in New York, right? What's his name here? Dr. Vladimir Zelenko. He's recommending a very high amount of zinc. So I'll pull it down. He's recommending, I think, 220 milligrams of zinc sulfate. So, yeah, I mean, I would do copper, add a couple of milligrams, 5, 10 milligrams, if you're going to be going that high. Keep that in the back of your head. Okay. Okay, cool. All right. Why not to grow a receptor farm that grabs coronaviruses? That's a great question. No idea. I think it's a trick question. Is it possible to make receptor farms? I don't even know. I never heard of a receptor farm. You can educate me. So the virus is on a cycle. Yes, it is. People need to understand that. People just think this virus is just like random and it has wings and it's going to fly and get you. It's on a relative cycle. People say, well, it's going to come back. There'll be a second wave. Well, I'm like, scratching my head. I'm like, well, where's the second wave of Zika? Where's the second wave of SARS? Where's the second wave of swine flu? Where's the second wave of MERS? Where's the second wave of whatever, right? I just can't think, like, in my life, the last 20 years or so of viruses that I've been tracking, I don't remember second waves outside of like the flu, right? That's seasonal. So I'm not sure what the data is. And again, if you listen to Paul Offit's interview, really, he thinks there's a fecal oral component with this because it's not spreading like flu. People talk about the R0 number or the R0 number. I talked about this earlier. And that's how infectious this infection is, how much it can spread. And let me go find that study again here for y'all. Right? So the R0 number is 2 to 3.11, how contagious it is. And they're comparing the flu at, where's the flu here? Am I missing it? Seasonal flu, 1.3. But the seasonal flu spreads to 3 million people. This is only spread to not even 1 million people in the world. Conservatively, we'll multiply it by 10x, 10 million people in the world. Okay, even if we say, okay, 100 million people in the world, guess what? The flu goes to 350 million people. No, the flu goes to 600 million people in the world. Okay, so way more than that. Let me keep rolling with y'all. All right, excellent. Keep up the great work. Yeah, you're welcome, Liz. Thank you so much. Appreciate it. Will the coronavirus be serious in most people, or will it likely present with milder symptoms? So, I try to give you guys the real data. The problem is when I give it to you, a lot of people are like, oh my gosh, like you're not taking it seriously. It's like, guys, I'm just using data here. So if someone says, hey, you have a 90+% chance of getting this infection and having no symptoms, that's pretty awesome. That's pretty good. And then out of the people that actually get it, the odds are that you're going to actually pass from this thing is going to be more than likely down to a 0.5% or less rating. And it's going to primarily be someone that has comorbidities and is greater than 70. Keep that in mind. Now, once the economy starts up again, should people that are older still quarantine? Yeah, I think it'd be still smart. I would still get out and get sun and try to get spaced, especially if you're in a climate that's warmer, because this virus does not like heat or humidity. It's what it seems. I showed a data point on that yesterday. Again, I'm getting new viewers all the time, so I'll just chime this in real fast so you guys can see I'm not full of it. This is a study looking at relative heat and humidity. So here are cases. So you can see as on the X graph, temperature goes up. Guess what happens to the number of cases? They drop. And so each area has to be a city with at least 40 or more cases. And you can see it follows a linear regression. As temperature goes up, cases go down. That's actually good news for us as we go into spring. Love that news. Okay, let me keep on rolling with y'all. Would you suggest treating pneumonia naturally by someone with asthma right now? Feel great, but very persistent cough, suspecting minor infection. So I would be doing ginger. I would be doing N-acetylcysteine. I would be nebulizing with glutathione if I could. Now, if you don't have a nebulizer or the right glutathione, forget about it. It's just everything's backordered. It's crazy. But I'd be doing astragalus. I'd be doing maybe wart, I'd be doing NAC, I'd be doing zinc, I'd be doing vitamin A, vitamin C. I mean, it just depends, right? I'd have at least a stack of 5 things. So let's just say vitamin C, vitamin D. Why vitamin D? If you have low vitamin D levels, guess what the research says on vitamin D? Vitamin supplementation with prevent acute respiratory tract infections, systemic review. That means systemic means it's lots of different studies. People with low vitamin D, they find that when you supplement vitamin D, it protects against acute respiratory infections overall, especially when